Hello everyone, my name is Dr. Caroline Whittick and I'm a physiotherapist at Back Into Motion Physiotherapy Clinic. I just want to talk about what's involved in a pelvic floor physiotherapy session. Just like in a regular physical therapy session, we would take a history to find out what brings you to the clinic, what issues you're having or challenges. We would also find out about your medical history, and then from there we would go into performing an assessment. We would observe your posture, your movements, and then ideally, in order to better figure out what's happening with the pelvic floor, we'd have to also examine the perineal area. That's the area where your vulva, vagina, and anus are. So you would observe and palpate externally, but then also usually an internal examination is indicated to try to also get more information of what's happening with the pelvic floor muscles in terms of how they're functioning. So that's where you would have to actually use where a gloved digit would be inserted into the vaginal canal to be able to palpate the different layers of the pelvic floor and to see how they're functioning. That doesn't have to be done, especially if the patient is not comfortable, especially on the first session. We would work with you. So if you're not comfortable having those particular aspects done, they don't have to be. Of course, it just helps get more information to help better guide treatment. But we can still work with, maybe if it's not the first session, maybe at a later session down. That will be discussed with your therapist, and then you can take it from there on a stage basis. Now, based on what is gleaned from the assessment portion, we would then discuss treatment, which may include certain types of exercises, stretches, or dietary recommendations or behavior recommendations that could help. So it's nothing to be scared about. It's pretty straightforward, and probably not as bad as you're picturing it would be. So hope that helps. Thanks. Bye.